difficult round. After the completion of each round, scores will be tallied and the top teams will be shown on the scoreboard. Teams, you will have 30 seconds for the easy questions and 45 for the moderate and difficult once I finish reading the questions. Teams, you will then write down your answers on the whiteboard if you have one. If not, a white piece of paper shall do. And when time is up, I will ask the team leaders to hold up their whiteboard or sheet of paper to their camera, revealing their answers, even if they do not have an answer. A very important message to our viewers and participants. Each team cannot view other teams' answers until the organizer makes the screen for that specific team available. In addition, to protect the integrity of this competition, we have also selected one proctor for each team to monitor each team to ensure that the whiteboards remain up when asked to do so. I hope that makes sense. Next, for multiple choice types of questions, simply having the letter of the correct answer choice will suffice. For open-ended questions, only those that are spelled correctly will be accepted. Abbreviations will not be accepted, so just to reiterate, spell things out and spelling does matter. I will then call on each team to reveal their answer and reward points accordingly. Finally, important enough, I do have to state this, if you as a team believe that you answered a question correctly but were not awarded points appropriately, you may ask for a challenge. The team captain will make an X signal with his or her arms, as so, on the camera to get the attention of the organizing committee, us, once I ask you, are there any challenges on the floor? The Board of Judges will then review your answer and decide whether or not points will be awarded. All decisions made by the Board of Judges are final. Keep in mind, once the question has passed, a challenge will no longer be accepted. And lastly, thank you everyone for bearing with me, but the team that garners the most points will be declared the winner of the second annual Battle of the Brains. In the case of a tie, one clincher question will be asked until a winner emerges. All right, teams. Before we proceed, we are going to pause for a reminder. Thanks for your patience in advance.
I'm Dr. Thomas Arvie. I'm a physical therapist, and I'm owner of FIAP, which is the Florida Institute of Orthopedic Manual Physical Therapy. We offer orthopedic certification programs for physical therapists, physical therapist assistants, and occupational therapists. Karen not only did her PTA certification this year, but also completed her safety certification. So she's getting 2 of these tonight. So great job. We've been running these programs for over 5 years. We have over 100 graduates, and tonight we're at the Funky Voodoo restaurant in Oakland Park, Florida, at a graduation event with over 25 graduates this year.
I want to say thank you very much, Thomas, and your fantastic company for teaching me and getting me certified over here.
Every single one of our graduates right now said, you know what, I want to be better, and I want to be better for my patients. And that is a huge sign of integrity and professionalism. And I think that we should all give them a round of applause just for that. We will be offering programs in 2018. Check out our website at fiompt.com, fiompt.com, for more information.
Teams, are you ready? Now, let's begin the Battle of the Brains Season 2. First up, the easy round. Here is question number 1. What is the cranial nerve innervation of the muscles that move the tongue? You have 30 seconds. Go! time is up. Please raise your whiteboards. Keep them up. All right, all whiteboards are up, and the correct answer is cranial nerve 12, or hypoglossal nerve. Teams, let's see your answers, starting with Concord Career Institute of Miramar. Please reveal your answer. Concord, that is correct. Florida National University, please reveal your answer. Florida National, that is correct. Gulf Coast State College, please reveal your answer. That is also correct. Miami-Dade College, let's see your answer.
Okay.
Miami-Dade, that is incorrect. And lastly, Pensacola State College, please reveal your answer. Pensacola State College, that is incorrect. All right, teams, we are going to go ahead and move on to question 2 of the easy round. Question 2, what is terminology referring to the bluish-gray discoloration of the skin and mucous membranes? Once again, what is terminology referring to the bluish-gray discoloration of the skin and mucous membranes? You have 30 seconds. Timer begins now. Teams, time is up. Those 30 seconds go by pretty quickly, so please raise up your whiteboard. Florida, yes. All right, all whiteboards are up, and the correct answer is cyanosis. Teams, let's see your answers, starting with Concord. Please reveal your whiteboard. Concord, that is correct. Florida National University, let's see your whiteboard. Florida National, that is also correct. Gulf Coast State College, let's see your answer. Gulf Coast, that is correct. Miami-Dade College, let's see your answer. Miami-Dade College, unfortunately, that is incorrect. Pensacola State, let's see your whiteboard. Pensacola, that is correct. All right, everybody, moving on to question 3 of the easy round. Question 3 reads, which of the following cranial nerves has solely motor function? A, cranial nerve 2, optic. B, cranial nerve 5, trigeminal. C, cranial nerve 7, facial. Or D, cranial nerve 11, special accessory. Timers begin now. D is supposed to read spinal accessory. Our apologies. Teams, time is up. I'm so surprised with how fast 30 seconds goes by. All right, everybody, please raise up your whiteboards. All whiteboards are raised, and the correct answer is D, cranial nerve 11, spinal accessory. All right, teams, time to reveal your answers. Concord, let's start with you. Concord, that is correct. Florida National, let's see your answer. Florida National, that is also correct. Gulf Coast State College. Let's see your answer. Gulf Coast, that is also correct. Miami-Dade College. Let's see your answer. Miami-Dade, that is incorrect. And lastly, Pensacola State College. Let's reveal your answer. Pensacola, that is correct. All right, everybody. Hope everybody's having a good time. I know I am. Let's go ahead and continue. Question number 4 of the easy round. Which of the following nerve roots does the bicep tendon reflex test? A, C5, B, C7, C, L4, D, S1. You have 30 seconds. Go! Teams, time is up. Please raise your whiteboard. All whiteboards raised? All right. And the correct answer is A, C5. Teams, let's go ahead and see your answers, starting with Concord. Concord, that is correct. Florida National, let's see your answer. Florida National, that is incorrect. Gulf Coast State College, let's see your answer, please. Gulf Coast, that is correct. Miami-Dade, let's see what we're working with. Miami-Dade College, that is correct. And Pensacola State College, please reveal your answer. Pensacola State, that is correct. My apologies, I did not ask this question for the 3 previous questions, but are there any challenges on the floor for this particular question? No challenges on the floor, we may proceed. Question number 5 of the easy round. We're halfway there, everybody. Which grade would you classify a deep tendon reflex that appears normal? A, 1+, B, 2+, C, 3+, or D, 4+. Timer's starting now. Get to it. Teams, time is up. Please raise up your whiteboards. All whiteboards raised? Awesome. And the correct answer is B, 2+. Teams, let's go ahead and see those answers. Enough listening to me. Concord, let's reveal your answer. Concord, that is incorrect. Florida National University, please reveal your answer. Florida National, that is also incorrect. Gulf Coast State College, please reveal your answer. Gulf Coast, that is incorrect. Miami-Dade, please reveal your answer. Miami-Dade, that is incorrect. Pensacola State College, please reveal your answer. Pensacola State, that is correct. All right, everybody, moving on to question 6 of the easy round. Please identify this type of orthosis pictured to the right. Timers begin now. Go! teams, time is up. And the correct answer is halo cervical orthosis or just halo. We will accept either or. Teams, please reveal your answers. I'm sorry, teams, please raise up your whiteboards. All whiteboards are up. We're going to go ahead and go with Concord. Let's see your answer. Concord, that is incorrect. Florida National, please reveal yours. Florida National, that is incorrect. Gulf Coast State, please reveal your answer. Gulf Coast, that is correct. Miami-Dade College, please reveal your answer. Miami-Dade, that is correct. Pensacola State College, please reveal yours. And Pensacola, that is also correct. Awesome job, everybody. We're chugging along. We're going to go ahead and move on to question 7 of the easy round. Oh, I'm sorry. Before we move on, are there any challenges on the floor for the previous question? No challenges on the floor. We're going to go ahead and move on. Question 7. Please identify the non-invasive instrument used to examine pulses that are extremely weak or faint, that are obliterated by even slight pressure or when arterial flow is severely compromised, like in the case of a DVT. Time begins now! Time is up. Please raise up your whiteboards. All whiteboards up? Awesome job, everybody. The correct answer is Doppler ultrasound or just Doppler. Once again, we will accept either or. All right, teams, let's see your answers. Starting with, everybody guessed it, Concord. Unfortunately, that is incorrect. Next, Florida National University, please reveal your answer. Florida National, that is incorrect. Gulf Coast State College, let's see your answer. Gulf Coast, that is incorrect. Miami-Dade, please reveal your answer. Miami-Dade, that is incorrect. And Pensacola State College, let's see your answer. Pensacola, that is incorrect. Alrighty, everybody, moving on to question 8 of the easy round. FSBPT protects the public by providing service and leadership that promotes safe and competent physical therapy practice. Please transcribe FBSPT. I apologize. Please transcribe the abbreviation that is in the beginning of this question. FSBPT. Timers begin now. Alright, teams, time is up. Remember, spelling does count. Teams, please raise up your whiteboards. All whiteboards are raised, and the correct answer is the Federation of State Boards of Physical Therapy. Concord, let's reveal your answer. Concord, that is incorrect. Florida National University, let's see yours. Florida National, that is incorrect. Gulf Coast State College, let's see that answer. Gulf Coast, that is incorrect. Miami-Dade College, please reveal your answer. Miami-Dade College, that is incorrect. Pensacola, please reveal yours. Pensacola, that is incorrect. Teams, are there any challenges on the floor before we proceed? No challenges? We shall move on. Question 9 of the easy round. What? Ooh, sorry, that was the answer to the previous one. What is a measure of central tendency that is the central number of a data set? I'm going to read that again. What is a measure of central tendency that is the central number of a data set? Timer begins now! Alright team, time is up. At this point you should already know, but please raise up those whiteboards. All whiteboards are raised. Let's go ahead and reveal those answers. Concord Career Institute. Oh, I keep doing that. I'm sorry everybody. The correct answer is median. Now, let's go ahead and reveal those answers. Concord Career Institute. That is incorrect. Florida National University, please reveal your answer. Florida National, that is correct. Gulf Coast State College, please reveal yours. Gulf Coast, that is also correct. Miami-Dade College, please let us see your answer. Miami-Dade College, that is incorrect. And Pensacola State College, please reveal yours. Pensacola State, that is incorrect. As with the last question, are there any challenges on the floor? No challenges? We may proceed. Last question of the easy round. All right, everybody. Kill it with a bang, all right? Not kill it with a bang, end it with a bang. You know what I'm saying. Anyway, question 10 of the easy round. What is the primary hip flexor? Timers begin now. Teams, please raise up your whiteboards. All whiteboards are raised. Awesome job, everybody. And the correct answer is iliopsoas. Teams, let's see your answers. This is the most exciting part for us. Concord, please reveal yours. Board of Judges. All right, we are going to have to communicate with the Board of Judges. Board of Judges, Dr. Johnson.
Yeah, can you hear me?
Yes, sir.
Will you accept SOAS?
Look. I mean, it is. Obviously, SOAS major is one of the two. I would say it's an incomplete answer.
Okay. Thank you so much, Dr. Johnson. You heard him here first. Incomplete answer. Concord, I'm sorry, but that is incorrect. Great attempt, though. Florida National, please reveal your answer. Florida National University, that is correct. Gulf Coast State College, please reveal your answer. Gulf Coast, that is correct. Miami-Dade College, please reveal your answer. Miami-Dade, that is also correct. And last but certainly not least, Pensacola State College. Let's see that whiteboard. Pensacola State College, way to end it with a bang. That is correct. All right, everybody, that completes the easy round. We're going to go ahead, before we reveal the scoreboard, let's hear a word from our sponsors.
The University of Miami is well known for its commitment to excellence while educating its Doctor of Physical Therapy students. That same commitment can now be found in our 6 physical therapy residency programs. Our team is now proud to offer post-professional residency programs in a variety of practice specialties. Such areas of practice include cardiovascular and pulmonary rehab, geriatrics, neurology, orthopedics, pediatrics, and sports physical therapy. Whatever your desired specialization may be, you'll find it here at the U. We are currently seeking candidates to apply for the position within the 2021 to 2022 cohort. We seek current licensed physical therapists or soon-to-be DPT graduates who are passionate about excelling into a particular field of practice within the profession. All our residency programs strive to promote distinction and mastery within practice, leadership within our profession, and innovation for the future. We hope that you'll strongly consider University of Miami for your post-professional residency training. For more information, see our website at pt.med.miami.edu. Thank you.
I'm Dr. Thomas Everly. I'm a physical therapist, and I'm owner of FPTA, which is Florida Institute of Orthopedic Manual Physical Therapy. We offer orthopedic certification programs for physical therapists, physical therapist assistants, and occupational therapists. Karen not only did her PTA certification this year, but also completed her safety certification. So she's getting 2 of these tonight. So great job. We've been running these programs for over 5 years. We have over 100 graduates, and tonight we're at the Funky Voodoo restaurant in Oakland Park, Florida, at a graduation event with over 25 graduates this year.
I want to say thank you very much, Thomas, and your fantastic company for teaching me and getting me certified over here.
Every single one of our graduates right now said, you know what, I want to be better, and I want to be better for my patients. And that is a huge sign of integrity and professionalism. And I think that we should all give them a round of applause just for that. We will be offering programs in 2018. Check out our website at fiompt.com, FIOMPT.com, for more information.
Thank you, Dr. Gimple from the University of Miami and Dr. Everly for those 2 commercial breaks. Welcome back to the FPTA Battle of the Brains Season 2. Let's go ahead and reveal the scoreboard to see our top 3 teams. In first place, we have Gulf Coast State College with 7 points. Bringing home the silver in second place, we have Pensacola State College with 6. And in last place with the bronze, we have Florida National University with 5 points. All right, teams, are you ready? We're going to go ahead and move on to the moderate round. Question number 1. What is the strongest bone in the body? Timers begin now. Go! Just kidding, it's moderate round. All right, teams, 45 seconds is up. As you know, please go ahead and raise those whiteboards before I reveal the answer. All whiteboards are up, and the correct answer is femur. All right, teams, let's see those answers. Concord Career Institute, that is correct. Florida National? Florida National, that is also correct. Gulf Coast State College, please reveal yours. Gulf Coast, that is correct. Miami-Dade College, please reveal your answer. Miami-Dade, that is correct. Pensacola State College, please reveal yours. Pensacola, that is also correct. We went 5 for 5, everybody. Keep it up. I'm assuming no challenges on the floor? No challenges on the floor. Let's go ahead and proceed. Question number 2 of the moderate round. Keep in mind, these questions are worth 2 points. And the question reads, which of the following examples is associated with a third class lever? A, doing a bicep curl with a 15-pound dumbbell. B, pushing a wheelbarrow with a load of rocks. I was about to say socks. C, doing a push-up. Or D, pulling a sandbag via rope and pulley system. 45 seconds on the clock. Go! All right, team, 45 seconds is up. Please raise those whiteboards before we reveal the answer. All whiteboards raised? Dr. Vitente? All whiteboards are raised. And the correct answer is A, doing a bicep curl with a 15-pound dumbbell. All right, you guys know the deal. Concord, let's see that answer. Concord Career Institute, that is incorrect. Florida National, let's see that answer. We can see it. Yes, that is A, right? Can you guys shift that a little bit? The lighting is weird. Oh, perfect. Yes, that is correct. Florida National. Gulf Coast State College, please reveal your answer. Gulf Coast, that is correct. Miami-Dade, please reveal yours. Miami-Dade, that is also correct. Pensacola State College, please reveal your answer. Pensacola, that is incorrect. Any challenges on the floor? No challenges on the floor. We're going to go ahead and proceed to question 3 of the moderate round. Please identify the nerve for the sensory distribution coded in yellow. 45 seconds on the clock. Go! Alright teams, 45 seconds is up. Please raise those whiteboards. All whiteboards raised, Dr. Vitente? Got the thumbs up. Alright everybody, and the correct answer is... the ulnar nerve. Teams, let's see those answers, starting with Concord. Please reveal your answer. Concord Career Institute, that is correct. Florida National, let's see yours. Florida National, that is also correct. Gulf Coast State College, let's see that answer. Gulf Coast State College, that is incorrect. Miami-Dade College, let's see your answer. Miami-Dade, that is correct. And lastly, Pensacola State College, please reveal your answer. Pensacola State, that is correct. Any challenges on the floor?
GCSE challenge.
GCSE challenges. We're going to go ahead and unmute you. Go ahead and speak.
So we were saying on the chart it's
It's what? Sorry, we can't hear you very well.
The dermatome chart says C8.
The dermatome chart says C8. Board of Judges?
That would be true, but it does ask for the nerve and not the nerve root. So at this point, I would still say that it's discussing the nerve, so it's going to be ulnar nerve for the answer.
Incorrect.
Alrighty, so GCSC, that is incorrect. Dr. Johnson, thank you so much. Any other challenges on the floor? No challenges. Let's go ahead and move on. Question 4 of the moderate round. Observe the direction of force indicated by the pink arrow of the left hand of the physical therapist assistant. Provide only one motion of the shoulder that will be increased from this glide. 45 seconds on the clock, starting now. I know you already know, but I have to say it anyway. Please raise those whiteboards. All whiteboards are raised, and the correct answer is flexion or internal rotation. If you have either one of those on your whiteboard, it will be considered correct. Teams, let's see those answers. Concord, that is correct. Florida National, that is also correct. Gulf Coast State College, let's see that answer. Gulf Coast, that is correct. Miami-Dade College, please reveal your answer. Miami-Dade, that is correct. Pensacola State College, please reveal your answer. Pensacola State, that is correct. There's something about 5 for 5 that just puts a smile on my face. Awesome job, guys. Let's go ahead and move on. Question number 5 of the moderate round. Bear with me, and it reads, the concept of being able to maintain a conversation while performing an activity is thought to correlate with moderate intensity aerobic exercise, while only being able to say a few words without taking a breath or having difficulty maintaining a conversation correlates with vigorous intensity. Please provide us with the name of the test. 45 seconds on the clock. Go! All right, teams, time is up. Please raise your whiteboards. All whiteboards are raised. And the correct answer is the talk test. Simple as that. Teams, let's see your answers. Concord Career Institute. Concord, that is correct. Florida National University, please reveal yours. Florida National, that is incorrect. Gulf Coast State College, please reveal your answer. All right, Gulf Coast, that is incorrect. Unfortunately, Miami-Dade College, please reveal yours. Miami-Dade, that is correct. And Pensacola State, let's see your answer. Pensacola State, that is incorrect. Any challenges on the floor before proceeding? No challenges? We shall move on. Question 6 of the moderate round. And it reads, what is the terminology that refers to the separation of the rectus abdominis muscles in the midline at the linea alba? 45 seconds, go! Raise those whiteboards and keep them up. All whiteboards are raised? All right, and the correct answer is diastasis rectus abdominis or diastasis recti. We will accept either or. Teams, let's see those answers. Concord Career Institute. That is incorrect. Florida National, let's see your answer. Florida National, that is incorrect. Gulf Coast State College. Gulf Coast, that is correct. Miami-Dade College, please reveal your answer. Miami-Dade, that is correct. Pensacola State College, let's see yours. Pensacola, that is incorrect. Any challenges on the floor before proceeding? No challenges? We shall move on. Question 7 of the moderate round. All right, everybody. Question reads, what are the two motions to put the hamstrings to a point known as active insufficiency? I'm going to read that again. What are the two motions to put the hamstrings to a point known as active insufficiency? 45 seconds on the clock. Go. Again, we are looking for two answers here. All whiteboards up? All whiteboards are up. Teams, let's go ahead and reveal your answers. Concord Career Institute. I'm sorry. The correct answer is hip extension and knee flexion. Now, Concord Career Institute, please reveal your answer. Concord Career Institute, that is correct. Florida National, let's see yours. Florida National, that is also correct. Gulf Coast State College, please reveal your answer. Gulf Coast State, that is correct. Miami-Dade College, please reveal your answer. Miami-Dade, that is correct. And Pensacola State College, please reveal your answer. Pensacola State College, that is correct. Another 5 for 5. Let's keep going, everybody. Question 8. Are there any challenges? I assume not, just to make sure. No challenges on the floor? Let's go ahead and proceed. Question 8 of the moderate round. What is the terminology that refers to a rhythmic, quick, oscillatory, back and forth movement of the eyes? 45 seconds on the clock. Go! Teams, please raise your whiteboards. All whiteboards raised? Awesome. And the correct answer is nystagmus. Concord Career, you know the deal. Yes, that is correct. Florida National, reveal that answer. Florida National, that is incorrect. Gulf Coast State College, please reveal your answer. Gulf Coast, that is correct. Miami-Dade, let's see that answer. Miami-Dade, that is correct. And Pensacola State College, please reveal your answer. Pensacola, that is correct. All right, any challenges on the floor before proceeding? No challenges on the floor? We shall move on. Question 9 of the moderate round. The OASIS, or Outcome and Assessment Information Set, was designed to ensure the collection of pertinent data on the adult patient in which of the following settings? A, inpatient rehabilitation facility, B, home health, C, skilled nursing facility, or D, outpatient clinic. 45 seconds on the clock. Get going. Team, time is up. Teams, please raise your whiteboards. All whiteboards are raised, and the correct answer is B, home health. Let's go ahead and see those answers. Concord, please reveal your answer. Concord, that is incorrect. Florida National, let's see yours. Florida National, that is incorrect. Gulf Coast State College, please reveal yours. Gulf Coast, that is incorrect. Miami-Dade, let's see that whiteboard. Miami-Dade, that is correct. And Pensacola State College, please reveal, and that is incorrect. Y'all are too fast for me. All right, any challenges on the floor before proceeding? No challenges? We shall continue. Last question of the moderate round. After this, only 10 more. All right, everybody, what is the most common chronic pulmonary disorder and is considered as the 4th leading cause of mortality in the world? 45 seconds. Get to work. Team, time is up. Please raise your whiteboards. All whiteboards raised? Not yet. All right, all whiteboards are raised, and the correct answer is chronic obstructive pulmonary disease. Just a warning, we will not accept COPD. As the rule we discussed earlier, you must spell the whole thing out. All right, teams, Concord, reveal your answer. Board of Judges, we need your assistance. Dr. Johnson?
Yes. I would say that's close enough.
All right. That is correct. Thank you, Dr. Johnson. Concord, that is correct. Florida National University, please reveal your answer. Florida National, that is incorrect. Gulf Coast State College, please reveal your answer. Gulf Coast, that is correct. Miami-Dade College, let's see your answer. Miami-Dade, that is incorrect. And lastly, but certainly not least, we have Pensacola State. That is correct. All right, everybody, that sums up the moderate round. We have 10 more questions for the difficult round, but right now we're going to pause and hear a word from our sponsors.
Miami is a great city.
I love Miami. I've been here my whole life.
There's just such a diversity of people.
People from all different cultures, all different backgrounds.
This is the place to be.
There's just so much to do around here. It's like in the central of Miami.
This is like the heart kind of Miami.
The spices of Little Havana, the historic district.
The trolley, which is unique to Coral Gables, as well as like the metro to get around the city. Not too far from here, there's Miracle Mile.
Also has a lot of really nice, boutique restaurants.
Restaurants everywhere.
We have a very famous one called Versailles. Grab their cafecito with croquetas and pastries, which are very unique to Miami.
You have the beach, you have great nightlife here.
The water is really pretty down here. The beach is only 20 minutes away.
It's very fun here.
Did you know NSU offers 2 fully accredited clinical residency programs in neurologic and orthopedic physical therapy? We partner with 2 major health systems and 2 state-of-the-art clinics for residency placements in Southeast Florida and Tampa. Our residents receive mentoring from board-certified clinical and academic faculty and gain valuable experience teaching in our DPT programs. To find out more, visit our website or schedule a virtual or on-campus tour. See what NSU can do for you.
All right, everybody, welcome back to the FPTA Battle of the Brains Season 2. Let's reveal the scoreboard to see our top 3 teams. And in first place, we have a tie between Gulf Coast State College and Miami-Dade College with 21 points. Coming in with the silver, we have Pensacola College and Concord Career Institute with 18 points. And then coming into third place, bronze trophy, we have Florida National University with 15 points. We're neck and neck, everybody. We have 10 more questions of the difficult round, each question worth 3 points. Kind of a big deal. All right, teams, are you ready? Let's see some excitement. 10 more questions. All right, everybody, question 1 of the difficult round. Please fill in the blank. Blank exercise is a static form of exercise in which a muscle contracts and produces force without an appreciable change in the length of the muscle and without visible joint motion. You have 45 seconds. Go! All right, teams, 45 seconds is up. Please raise your whiteboards. Wow, all whiteboards are raised. Thank you for taking my instructions. All right, the correct answer is isometric. All right, teams, let's see those answers. Concord, that is correct. Florida National, that is also correct. Gulf Coast, that is correct. Miami-Dade College, let's see that answer. Miami-Dade, that is correct. And Pensacola State College. Pensacola State, that is correct. 5 for 5. I have to ask, any challenges on the floor? I assume not. No challenges? We may proceed. Question 2 of the difficult round. And it reads, the physical properties of water have a direct effect on the body in the aquatic environment. What is the physical property of water that refers to the upward force that works opposite to gravity? 45 seconds. Get to work. Is up. As you already know, please raise those whiteboards and keep them up. All right, all whiteboards are up and the correct answer is buoyancy. All right, let's reveal those answers. Concord. Concord, that is correct. Florida National, let's see yours. Florida National, that is also correct. Gulf Coast State College, let's see that answer. Gulf Coast, that is correct. I'm sensing a trend here. Miami-Dade College, please reveal your answer. Miami-Dade, that is correct. Pensacola State, let's see your answer. I knew it! Pensacola State, that is correct. 5 for 5, everybody. I'm assuming no challenges on the floor. Let's go ahead and continue. Question 3 of the difficult round. What is the term referring to the limitation of a joint without inflammation? 45 seconds on the clock. Go! All right, teams, time is up. Thank you, Zofia Hack, for taking such incredible time this whole time. Couldn't do it without you. All right, teams, raise those whiteboards. Whiteboards are up, and the correct answer is arthrosis. Teams, let's see those answers. Concord? Concord, that is incorrect. Florida National? Florida National, that is incorrect. Gulf Coast State. Gulf Coast, that is incorrect. Miami-Dade College. Miami-Dade, that is incorrect. Pensacola State College, please reveal yours. Pensacola State College, that is correct. Any challenges on the floor before we proceed? No challenges? We shall move on. Question number 4 of the difficult round. Please identify the deformity indicated by the green arrow to the right of the screen. 45 seconds on the clock. Timer begins now. right, teams, time is up. Please raise your whiteboards. Dr. Vitente, all whiteboards up, all whiteboards up. And the correct answer is, could be any one of these will be accepted. Tibia vera of proximal third, genu verum, deformity, lateral tibial torsion, or medial femoral torsion. Once again, we will accept any of the above responses. Let's go ahead and start with Concord Career Institute. Concord, that is correct. Florida National University. Florida National, that is correct. Gulf Coast State College, please reveal yours. Gulf Coast, that is correct. Miami-Dade College, please reveal your answer. Board of Judges, Dr. Johnson, we need your assistance on this one.
Though that is the obviously layman's term for it, I would say that you'll have to use genu verum as the medical term for it.
Correct.
Okay, Dr. Johnson, thank you so much. Miami-Dade College, unfortunately, that is incorrect.
Genu verum. You talking to me?
Yes. Dr. Johnson, is it correct or incorrect?
Incorrect, correct? Dr. Johnson, is Miami-Dade College's response correct or incorrect? Want to give me a thumbs up or thumbs down?
Sorry, I had a little technical difficulty. What was it? Sorry, what were you guys talking about?
Is Miami-Dade College's response of bow-legged, is that correct or incorrect?
I would say incorrect.
Okay. Dr. Johnson's, once again, the decision by the Board of Judges is always final. So unfortunately, Miami-Dade College, that is incorrect. Pensacola State College, please reveal your answer. Pensacola State College, that is incorrect. All right, everybody, any challenges on the floor? No challenges? We're gonna go ahead and proceed. Halfway through the difficult round, everybody, hang tight. Question 5. Please fill in the blank. Adjust the width of parallel bars, if possible, to provide approximately blank inches of space between each of the patient's hips and the bar. I'm going to read that again. Fill in the blank. Adjust the width of the parallel bars, if possible, to provide approximately blank inches of space between each of the patient's hips and the bar. 45 seconds. Get to work. Is up. You already know, but I have to say it. Please raise your whiteboards. Florida National, please raise your whiteboard. All whiteboards are up. We're going to go ahead and give you the answer, and that is 2 to 4 inches. Concord, let's see your answer. Concord, that is correct. Florida National University, please reveal yours. Florida National, that is also correct. Gulf Coast State College. Gulf Coast, that is correct. Miami-Dade College, please reveal your answer. Miami-Dade, that is correct. And Pensacola State College, please reveal your answer. Pensacola State, that is incorrect. Any challenges on the floor before proceeding? No challenges? We shall continue. Question number 6 of the difficult round. Again, all of these worth 3 points apiece. What is the normal value for the partial pressure of carbon dioxide dissolved in arterial blood? 45 seconds on the clock. Go! All right, teams, time is up. Please raise those whiteboards. All whiteboards up, Dr. Vitente? All whiteboards are officially up, and the correct answer is 35 to 45 millimeters of mercury. All right, Concord, let's see that answer. That is correct. Florida National, let's see your answer. Florida National, that is incorrect. Gulf Coast, see your answer. Gulf Coast, that is incorrect. Miami-Dade College, let's see that answer. Miami-Dade, that is incorrect. And Pensacola State College. Pensacola State, that is incorrect. Any challenges on the floor? No challenges? We shall proceed to question 7 of the difficult round. Question 7 reads, what is performed with exogenous, thank you Dr. Vitente, agents such as collagenase, which are applied to the wound to remove necrotic tissue that allows the wound to heal more effectively. Just for my own sake, I'm going to read that again. What is performed with exogenous agents such as collagenase, which are applied to the wound to remove necrotic tissue that allows the wound to heal more effectively? Timer begins now. All right, teams, time is up. Please raise those whiteboards. Florida National, please raise your whiteboard. All whiteboards are up. And the correct answer is chemical or enzymatic debridement. Just kidding, it's supposed to just say debridement. All right, Concord Career Institute, let's see your answer.
Board of Judges.
Board of Judges. Looks like we may need your help on this one. Dr. Johnson?
Gary muted.
Oh, let me talk to the other judges real quick about this one.
Okay, we'll pause for a break.
We'll pause for a break.
If you ever want help, it's available from the professors at all times.
It's a school dedicated to the health sciences.
They have experience in different specialties.
Years of working in the clinic.
A lot of specialty certifications.
They give us examples from cases that they have worked on.
The facility, the amenities, all of that combined, I think makes this the place to be.
I feel like I'm learning from great leaders. I've met people from all around the country.
We really get to know each other. We're all comfortable.
Everybody's real close-knit. It's easy to get help whenever you need help.
I definitely have found a lot of great friends here.
Great friendships with everybody here within the school, not just in my own cohort.
We're basically one giant family here.
Good afternoon. My name is Dr. Thomas Everly, and I'm a physical therapist. I am the president and founder of the Florida Institute for Orthopedic Manual Physical Therapy, which provides postgraduate education to physical therapists in Florida specifically in the specialty of orthopedics. This past year, Florida passed legislation that updated the PT Practice Act. This update included the physical therapist's ability to perform dry needling. There's a few criteria that you need to know about this legislation. The first is you need to be practicing at least 2 years to be able to practice dry needling in Florida. The second criteria is that you need to complete 50 seminar hours. The third criteria is that you need to complete 25 patient sessions supervised by someone already certified in dry needling. And that's not just 25 procedures, it's actually 25 different sessions. I've served on the board of directors for the past 9 years of the FPTA. So I know firsthand the difficulty in this advocacy, literal fight to get this legislation passed. Not only to update all areas of practice, but specifically to allow physical therapists to dry needle in Florida. I'm very proud of my role in this advocacy fight, along with all my other board members and dozens of people across the state of Florida and actually outside of Florida. As far as my company goes, FIAMT has been a major sponsor of the FPTA for the past several years. We support the FPTA with dollars and resources to support physical therapy practice across the state. I've been practicing in Florida now for over 22 years, and I have done that personally as well, raising money for PAC, providing inexpensive CEUs through my company, FIAMT. Currently, FIAMT is the largest Florida-based provider of CE education for dry needling, including Dr. Joe Donnelly, who is our current APTA Orthopedic Academy president and chief editor of the Trigger Point Manual, which is the source manual for dry needling, trigger point examination and treatment. This text was originally produced by Dr. Janet Travell and Dr. Simons. So, when choosing a company to train you in dry needling, please consider all of these factors that I just mentioned, including it's not only about the 50 seminar hours, but who has the team that's going to be able to support you for the 25 sessions that is necessary to submit the paperwork to allow you to dry needle in Florida. FIAMT is committed to train as many PTs who would like to be certified in dry needling as quickly as possible. We have enough faculty to do courses in Florida, 1 to 2 a month, as well as support those 25 additional sessions.
All right, teams, welcome back. Dr. Johnson, the floor is yours.
Okay, so we discussed it, and it is an incomplete answer, so we'll have to say it is incorrect.
Okay, thank you for discussing it and letting us know. That was Concord, correct? Let's go ahead and move on to Florida.
Concord, incorrect.
That's what I meant. Concord Career Institute, that is incorrect. Comma, correct, question mark, Dr. Johnson? Yes. All right. We're going to go ahead and move on to Florida National University. Please reveal your answer. Florida National, that is incorrect. Gulf Coast State College, please reveal your answer. Gulf Coast. Board of Judges, we need your assistance again.
All right, I'm going to have to meet with the other guys real quick here. Hold on. Okay, so can you hear me? So yeah, we discussed it, and that answer is incorrect.
Okay. Gulf Coast, you heard it here first. That is incorrect. Miami-Dade College, please reveal your answer. Miami-Dade College, that is correct. Pensacola State College, please reveal your answer. Pensacola State College, that is incorrect. A quick message to our viewers. I am here looking at the screen, and I made sure that all whiteboards remained up as we discussed these questions with the Board of Judges. Just wanted to let everybody know that. Now, before we proceed, are there any challenges on the floor? No challenges on the floor? All right, we shall continue. Question 8 of the difficult round. If the patient experiences insulin reaction and is conscious, what is the best intervention? 45 seconds begins now. Go. All right, team, time is up. All whiteboards up. Florida National, please raise that whiteboard. Gulf Coast, please do the same. All whiteboards are up. Please keep them up. And the correct answer is ingest some form of sugar. Candy, orange juice, anything with sugar. All right, Concord, please reveal your answer. Concord, that is incorrect. Florida National University, please reveal yours. Florida National, that is incorrect. Gulf Coast, let's see your answer. Gulf Coast, that is correct. Miami-Dade, please reveal yours. Miami-Dade College, that is also correct. Pensacola State College, let's see your answer. And Pensacola State, that is correct. I don't know about you guys, but I cannot believe that we are down to the final 2 questions of the Season 2 Florida Physical Therapy Association Battle of the Brains. Question 9. If the patient, we already did this question. All right, it says 10, but we are on question 9. We'll fix that shortly. Question 10 of the difficult round. There are 5 steps in evidence-based practice. Identify the first. Again, there are 5 total steps in evidence-based practice. Please identify the first. 45 seconds starts now. Teams, time is up. Whiteboards up, please. All whiteboards up, Dr. Vitente? All whiteboards are up. Please keep them up. And the correct answer is identify a question. Simple as that. All right, Concord, please reveal your answer. Unfortunately, that is incorrect. Florida National, let's see yours. Board of Judges, looks like we'll need your assistance.
Can you get, what does that say? Formulate clinical scenarios. Okay. Let me talk with the other gentleman real quick. Hold on.
Thank you, Dr. Johnson. I muted you.
Thank you, Dr. Johnson. Dr. Johnson, the floor is yours.
Okay, so I talked it over with the two other gentlemen, and unfortunately, it's a little bit too vague. It's not enough information, so we'll have to say incorrect.
Heard it here first. That is incorrect, Florida National University. Moving on to Gulf Coast. Please reveal your answer. Board of Judges. Once again, Dr. Johnson.
All right, so I'll have to take the same route here. I mean, it's obviously the first part of it, but you don't really determine what you're asking, so you really have to finish that statement there. So I'll say incorrect.
All right, GCSC. That is incorrect. Thank you for the attempt, though, ladies. Miami-Dade College, please reveal your answer. Dr. Johnson, looks like we'll be needing yours.
Let me chat with the other gentleman real quick. Hold on.
Okay. Thank you, Dr. Johnson.
Okay. Yes, so we have decided that we will accept that as a correct answer.
All right, Miami-Dade College. I love the excitement. Yes, keep going, dance it out. All right, Miami-Dade, you heard it from Dr. Johnson. That is correct. Pensacola State College, please reveal your answer. Pensacola State, that is incorrect.
There is.
All right, any challenges on the floor? Yes, we have a challenge from Florida National University. Go ahead and...
Hi. So the word formulate means to ask, and the fact that we're using clinical scenarios, I believe, depicts our specificity of the question. So while asking a question is great, we're asking clinical questions.
Formulating a clinical scenario. Formulating a clinical scenario.
We're directly going to clinical scenarios. Yeah. We're not just asking vague questions.
Okay, let me talk to the other two judges. I appreciate your thought on it, so give me just a minute, okay?
Thank you. They unmuted us.
Just painting the picture of a clinical scenario. So it might be an introduction to a clinical question, but it doesn't mean that you're really asking.
we're going to go ahead and pause for another commercial break. Dr. Johnson will give you another minute to go ahead and debrief with the other judges.
Miami is a great city.
I love Miami. I've been here my whole life.
There's just such a diversity of people. People from all different cultures, all different backgrounds.
This is the place to be.
There's just so much to do around here. It's like in the central of Miami.
This is like the heart kind of Miami.
The spices of Little Havana, the historic district.
The trolley, which is unique to Coral Gables, as well as like the metro to get around the city. Not too far from here, there's Miracle Mile.
Also has a lot of really nice, boutique restaurants.
Restaurants everywhere.
We have a very famous one called Versailles. Grab their cafecito with croquetas and pastries, which are very unique to Miami.
You have the beach, you have great nightlife here.
The water is really pretty down here. The beach is only 20 minutes away.
It's very fun here.
Welcome back, Dr. Johnson.
Okay, so even after we talked about it, we still say it's incorrect, unfortunately. You guys have the right idea. That the big issue is that we have with it is that you can formulate a clinical scenario, but it doesn't necessarily mean that you're identifying or asking a question pertaining to that scenario. And I think that's really where the big issue we have with it. So unfortunately, we'll have to say incorrect. Good try there, guys.
All right. Thank you, Dr. Johnson. Thank you, Florida National University.
Thanks, FPTA.
All right, we have another challenge on the floor by Gulf Coast State College.
What was the question?
So for evidence-based practice, we learned the 5 A's for the acronym. Ask, acquire, appraise, apply, and assess. So that's why we put ask. And I feel like ask is the same thing as identifying a question.
I think it comes down to some semantics for me, because ask is still, for me, incomplete, because you could be asking multiple things instead of actually asking for an answer. But let me check with the other two judges. So hold on for just a second, okay?
Give it to us.
Okay. So after talking with the judges, we still stand by our incorrect, unfortunately. Ask is just a little bit, it doesn't complete the statement. Again, because you could ask an answer or ask for an answer. You could ask a lot of different things, but unfortunately, it has to be also asking a question or something pertaining to that. So we'll have to say incorrect, unfortunately.
All right, Dr. Johnson, thank you so much. GCSC, thank you for posing your challenge. Any other challenges on the floor before we move to the next and last question? All right, we're going to go ahead and continue. Last question of the Florida Physical Therapy Battle of the Brain Season 2. All right, question number 10. The Epley maneuver is a type of exercise that helps to treat the symptoms of BPPV. Please transcribe BPPV. All right, 45 seconds on the clock. Go! All right, teams. This is the last time you're going to hear me say this, but please, whiteboards up. And keep them up. All whiteboards up, Dr. Vitente? Florida National, please raise that whiteboard. All whiteboards are now up. And the correct answer is benign paroxysmal positional vertigo, also known as BPPV. Well, that's what the question said. I'm being silly. All right, everybody, you already know the deal. Concord, reveal your answer. Concord, that is incorrect. Florida National. Florida National? Let's see it. Bring it to the camera. Benign. Board of Judges. We may need your assistance on this one.
So can I ask what order that's supposed to be? It's, I mean, you got all the right pieces there. Hold on for just a second, okay?
What is the verdict, Dr. Johnson? Dr. John?
Okay. So after talking with the other judges, we've decided that it is incorrect due to spelling errors and it is not in proper order.
You heard it here, Florida National University. That is incorrect. Gulf Coast State College, please reveal your answer. Gulf Coast, that is incorrect. Miami-Dade College, please reveal yours. Give us a moment here. Miami-Dade College, that is correct. Pensacola State College, please reveal your answer. Pensacola State College, that is incorrect. Alrighty, everybody. That ends Battle of the Brain Season 2. Now, the moment you've all been waiting for, the scoreboard. Before we reveal the scoreboard, we're going to hear one more word from our sponsors. We'll be right back. Sorry, that ended a little too...
Miami is a great city.
I love Miami. I've been here my whole life.
There's just such a diversity of people. People from all different cultures, all different backgrounds.
This is the place to be.
There's just so much to do around here. It's like in the central of Miami.
This is like the heart kind of of Miami.
The spices of Little Havana, the historic district.
The trolley, which is unique to Coral Gables, as well as like the metro to get around the city. Not too far from here, there's Miracle Mile.
Also has a lot of really nice, boutique restaurants.
Restaurants everywhere.
We have a very famous one called Versailles. Grab their cafecito with croquetas and pastries, which are very unique to Miami.
You have the beach, you have great nightlife here.
The water is really pretty down here. The beach is only 20 minutes away.
It's very fun here.
All right, teams, thank you for your patience. And the moment you've all been waiting for, let's reveal the scoreboard at the end of PTA's Battle of the Brains. All right, everybody. We are so sorry about that. Thank you all for holding tight. For some reason, our Wi-Fi just kicked us off and we just got back on. I'm so sorry about that. Again, thank you to everybody. We're going to go ahead and reveal the final score. All right. Coming in third place, Concord Career Institute of Miramar with 33 points. Coming in with the silver, we have GCSC with a total of 36. And your champion for today's FPTA Battle of the Brains Season 2 is Miami-Dade College with a total of 42 points. Miami-Dade, let's hear from you. We're going to go ahead and bring you up on the screen. Let's hear a couple words.
They're not here. Let's start first with Concord. Or just GCSC.
All right, Miami-Dade College has left us. GCSC, how does it feel to be in second place? 36 points. Yay! Boo! Awesome job, ladies. We're very proud of you. Viewers and organizing committee. All right. And we are going to close this year's Battle of the Brains with some closing remarks from the Vice President of Florida Physical Therapy Association, Lizelle Pilgrim. See you at 4 o'clock for the PT Battle of the Brains. PTAs, I am so excited for you. Awesome job today. NDC, congratulations! First place. Awesome job, guys. Very excited for all of you. Thank you all for being here. Join us at 4 o'clock promptly for PT Battle of the Brains. Now we will be joined by Lizelle Pilgrim, Vice President of FPTA, for our close.
Good afternoon, everyone. My name is Lizelle Pilgrim. I am the current Vice President of the Florida Physical Therapy Association, and I am also an assistant professor at the University of St. Augustine for Health Sciences, the Miami campus. I just want to take this opportunity to say congratulations to our winners. You have earned your bragging rights for the next year, so take it in and enjoy that moment. We are so proud of your dedication towards the profession and obviously your dedication towards your studies. To all the participants, keep at it. We can't wait to have you in our profession and to see what you do to move our profession forward. I'd like to take this opportunity to thank Dr. Vitente, the current chair of the Southeast District, for helping with this event, and of course, Mackenzie and Sophia for your awesome work. We are so proud of you and we can't wait till you're graduates and are seeing what you do in the profession as well. I'd also like to take this opportunity to thank our sponsors, University of Miami, Nova Southeastern University, the Mutual of Omaha, the Florida Institute of Orthopedic and Manual Physical Therapy, ServCare Home Health, ComQuest Home Care, and art by Dr. Rhodey Joseph, the University of St. Augustine for Health Sciences, the Miami campus. Again, thank you to everyone for this great event, and I'll see you guys soon.
All right, everybody. That was Lizelle Pilgrim from the University of St. Augustine. The PTA battle concludes, so teams, feel free to log off. Again, we are so very proud of you guys. Miami-Dade College, way to kill it. GCSC in second and Concord in third. We'll see you guys in about 4 minutes for the PT battle. Awesome job. Sorry, we just got finished, as you can hear by my voice, a very, very fierce competition with the physical therapist assistant schools. So, please forgive us for kind of joining in a couple minutes late, but I'm going to go ahead and begin. Good afternoon, FPTA members, students, and viewers from across the state and beyond. Thank you all for joining us today. Welcome to the second annual FPTA Battle of the Brains. My name is Mackenzie Gussman, and I will be your quizmaster for today's competition. Before we get started, I would like to thank the FPTA Southeast District and Student Special Interest Group for helping make this event possible. Most especially the members of the organizing committee for this year's FPTA Battle of the Brains. In no particular order, thank you to Zofia Hack from the University of Central Florida, our scorekeeper for this year's event, Danny Randar from the University of North Florida, and lastly, certainly not least, drum roll please! Dr. C. Arvie Vitente, our one and only. Without him, this event could not be possible. So about that. Another technical difficulty. Dr. Vitente, thank you for being here at the University of Central Florida from the University of St. Augustine for Health Sciences. We are very excited to be hosting 7 PT teams representing their universities from across the state of Florida. But before we get started, we have the president of the Florida Physical Therapy Association, Dr. Thomas Eberly, for some opening remarks.
Welcome to the second annual FPTA Battle of the Brains event. My name is Dr. Thomas Eberly. I am a physical therapist and I'm an educator at the University of St. Augustine in Miami, and I'm currently the president of the Florida Physical Therapy Association. I'd like to take this opportunity to thank all of the physical therapy and physical therapy assistant programs across the state that have participated in the competition this year. I'd also like to thank the Southeast District Chair, Dr. Arvie Vitente, for taking the lead and putting this all together for a second year in a row. I'd also like to thank all of our sponsors for contributing funds to help the Florida Physical Therapy Association move their agenda forward. And all of these sponsors include the University of Miami, Nova Southeastern University, Mutual of Omaha, the Florida Institute of Orthopedic and Manual Physical Therapy, or FIOMT, ServCare Home Health, Conquest Home Care Plus, Art by Dr. Rudy Joseph, and the University of St. Augustine. Finally, I'd like to just wish all of you the best of luck. Ironically, the University of St. Augustine took the gold crown last year, so we'll see if they can repeat. And to the rest of the teams, good luck as well. I hope it's a great competition. Thank you again for being active members in the association. The FPTA is our voice to both protect practice and to move our agenda forward. So again, thank you for participation, and I look forward to a great competition. Good luck.
Thank you, Dr. Eberly. Such a very inspiring opening remark. Perfect way to kick off our PT battle. Now, before we introduce the judges for today, I would like Zofia Hack to have a word with you all. She is the chair of FPTA's Student Special Interest Group and today's scorekeeper.
Sorry about that. Thanks, Mac. Good afternoon, everyone. My name is Zofia Hack, as Mac said, and I am the chair of FPTA's Student Special Interest Group. And I am honored to serve as this year's scorekeeper for the second season of the Battle of the Brains. On behalf of the Student Special Interest Group, I'd like to wish all the participants best of luck in competing today, and may the best team win. Good luck out there, everyone.
You have made that PTA competition could not have been possible without you, and I mean that from the bottom of my heart. Now, before we introduce the judges for today's competition, let's hear from the American Physical Therapy Association President-elect, the one and only Mr. Roger Herr.
Hello, my name is Roger Herr, President-elect of the American Physical Therapy Association. The Battle of the Brains is impressive, and I'm in awe of the friendly competition and the potential bragging rights. Those of you I know in Florida have strong commitments to your teams, no matter what sport or activity. Everyone is a winner as you are engaged. The APTA mission is building a community that advances the profession of physical therapy to improve the health of society. This event, Battle of the Brains, fulfills the mission in a unique way and builds a healthy competition across Florida. I celebrate you in this second year.
Dr. Roger Herr, American Physical Therapy Association President-elect. Thank you so much for leading the way. We are so very excited about your leadership within our organization. All right, everybody, now it is time to introduce the judges of the Battle of the Brains. Join me in welcoming our first judge, the chair of the Board of Judges, Dr. Lucas Johnson, board-certified sports clinical specialist and adjunct faculty at Old Dominion University. Dr. Johnson?
Good evening, everybody. Good luck to you guys. And as she just mentioned, my name is Dr. Lucas Johnson. I'd like to introduce my two other judges that are working with me. So the first one is Dr. Elazar Tayag. He is a board-certified clinical specialist in geriatric and orthopedic physical therapy. And then the third judge working with me, or the second additional judge working with me, is Dr. Phil Dumaligan, and he is a board-certified clinical specialist in geriatric and neurological physical therapy. Good luck to you all, and hopefully you won't need us very much.
Dr. Johnson, thank you so much. We did use you quite a bit in the last competition, so we'll see how this one goes. All right, everybody, and now, the moment you've all been waiting for. Let's introduce our physical therapy teams who are competing to become Battle of the Brains Season 2 champions. In no particular order, we have Florida International University being represented by Danielle Agahan, Oscar Espinosa, and Jake Gillis. Next, we have Florida Southern College, Emily Ross, Miller Quinones, and Christina Delgado. Next up, Nova Southeastern University, Hannah DiLorenzo, Ashley Graham, and Nate Serkis. Sorry if I'm butchering anybody's last name. Next, University of Central Florida, Daniel Sheldon, Juan Rodriguez, and Scott Stokanas. Yeah, I love the excitement, boys. Next, University of Miami, represented by Brianna Luders, Rebecca Pedros, and Samantha Crespo. All right, next up, University of North Florida, Andrea Farmer, Rebecca Weimer, and Emil Azam. And last, certainly not least, University of St. Augustine, Miami campus, Matthew Fetter, Reed Lippman, and Valerie Thomas. All right, everybody. Thank you for being here today. We are so pumped for this year's event. Now, before we begin, I'd like to review some of the rules of this year's battle. Bear with me, it'll be a little long. Teams, there will be 3 rounds, an easy, a moderate, and a difficult, each consisting of 10 questions. For each correct answer, teams will receive 1 point for the easy, 2 points for the moderate, and 3 for the difficult. After the completion of each round, scores will be tallied and the top team will be shown via a scoreboard. Teams will have 30 seconds for easy questions, 45 seconds for moderate and difficult once I finish reading the question. Teams will write down their answer on their whiteboard, and when time is up, I will ask the team leaders to please hold up their whiteboard to the camera, revealing their answers even if they do not have one. An important message to our viewers. Each team cannot view other teams' answers until the organizer makes the screen for that specific team available. In addition, to protect the integrity of our competition, we have also selected one proctor to monitor each team. For multiple choice types of questions, only the letter must be written on the whiteboard. For open-ended questions, only those that are spelled correctly will be accepted. Abbreviations will not be accepted, so just to reiterate, please spell the word out, and spelling does matter. I will then call on each team to reveal their answer and reward points accordingly. Finally, and most importantly, if a team believes they answered correctly but were not awarded points, they may ask for a challenge. The team captain will make an X with his or her hands like this, and that will signal the organizing committee, Dr. Arvie Vitente, and myself, to bring you guys up to center screen, and you'll have an opportunity to talk to the board of judges, and they will review your answer and decide whether or not points will be awarded. All decisions made by the board of judges are final. Keep in mind, once the question has passed, a challenge will no longer be accepted. The team that garners the most points will be declared the winner of the second annual FPTA Battle of the Brains. In the case of a tie, one clincher question will be asked until a winner emerges. Whew. Sorry, y'all, I had to take a breath there. All right, teams, are you ready? Let's begin Battle of the Brains Season 2 PT competition. First up, the easy round. Here is question number 1. Coming up soon. All right. Question number 1. What is the resting position of the glenohumeral joint? You have 30 seconds. Timer start now. All right, team, time is up. I know, 30 seconds goes by pretty dang fast. All right, teams, raise up those whiteboards. Dr. Vitente, whiteboards up. University of St. Augustine, please raise your whiteboard. All right, all whiteboards are up, and the correct answer is 40 degrees to 55 degrees abduction, and 30 degrees horizontal adduction, scapular plane. All right, teams, let's see those answers. Florida International University, please reveal your whiteboard. Florida International University? That is incorrect. Florida Southern, please reveal your answer. Board of Judges, Dr. Johnson, looks like we're going to need your assistance on this one.
Let me see. So we've got, does that say horizontal abduction? And what's the bottom part say? Or horizontal. Okay, I see what you wrote there. Horizontal. I see it. Let me see here.
We were trying to abbreviate, and then we realized no abbreviation for and so then we tried to write the word in 2 lines.
Yeah. Okay, hold on for just a second here, okay?
All right, while Dr. Johnson is communicating with our other two judges, other schools, please make sure to keep those whiteboards up. I see that most people are following instructions, but just in case, just keep that whiteboard up the whole time, okay? Nice. And Dr. Johnson, the floor is yours.
Okay. Yeah, we talked it over, and that we will accept that answer. Just coming obviously from the flexion side of versus the abduction side of it, but still looking at scapular plane.
FSC, that is correct. Once again, decisions made by the Board of Judges are final. Nova Southeastern, it's your turn. Please reveal your answer. Nova Southeastern, that is incorrect. University of Central Florida, reveal yours. UCF, that is incorrect. University of Miami, let's see what you got. University of Miami, that is incorrect. University of North Florida, please reveal your answer. UNF, that is incorrect. University of St. Augustine, please reveal yours. USA, that is incorrect. Before proceeding to the next question, are there any challenges on the floor? No challenges on the floor? We shall proceed to question 2 of the easy round. Question 2 reads, identify the deformity indicated by the green arrow to the right side of this screen. Not green arrow with not. We're sorry about our spelling. We hope that your spelling is a little bit better. Anyway, 30 seconds begins now. All right, team, time is up. Please raise your whiteboards and keep them raised. Dr. Vitente, whiteboards are all up. I got the thumbs up. All right, and the correct answer is ... funnel chest or pectus excavatum. We will accept either or. All right, teams, let's see those answers. FIU, that is correct. Florida Southern, that is also correct. Well done. Nova Southeastern, that is correct. University of Central Florida, UCF, that is incorrect. University of Miami, let's see that answer. That is correct. University of North Florida, please reveal your whiteboard. UNF, that is correct. And lastly, USA, let's see your whiteboard. USA, that is incorrect. All right, any challenges on the floor before I proceed? No challenges, we shall proceed. All right, everybody, question 3 of the easy round. In this test, with patient in sideline position, examiner extends test leg. This can also be done with the patient in supine, where test leg is actually extended over the edge of the table. Please identify this test where pain in the sacroiliac joint is indicative of a positive test. That was a mouthful, but I believe in you guys. 30 seconds begins now. All right, team, time is up. Please raise your whiteboards. All whiteboards are up. Let's go ahead and see those answers. FIU. Gainsland's test is the correct answer. I am sorry. I just turned off one of our studio lights. Give me a moment. Everybody, please keep those whiteboards up. Good. Correct answer is Gainsland's test. Sorry. All right, FIU. Let's see your score, or let's see your whiteboard. FIU, that is incorrect. Florida Southern. FSC, that is incorrect. NSU, please reveal your whiteboard. NSU, that is incorrect. UCF, please reveal your whiteboard. UCF, that is incorrect. University of Miami, please reveal your whiteboard. UM, that is incorrect. UNF, please let's see your whiteboard. UNF, that is correct. Sorry, I did not mean to sound surprised, but the spelling was even accurate. Awesome job. Keep it up. USA, let's see your answer. USA, that is Board of Judges. We need your assistance. Dr. Johnson?
Let me confer with the other guys, just make sure how particular we want to be on the spelling.
What's wrong with it? Gaenslen. S. Yeah. That's an E. My handwriting's really bad. Hey, if I talk, you guys hear me? Can you guys hear me? Hello?
Yes, let's wait for the Board of Judges.
Can you guys hear me? Sorry, my handwriting's really bad.
Okay. So I talked to the other two on the Board of Judges. Unfortunately, since we can't tell what that letter is, we'll have to reject it and say it's an incorrect answer.
No way. Are you serious?
Yeah, and important to have good handwriting in the clinic.
Thank you for that. University of St. Augustine, I'm so sorry, but that is incorrect. Once again, spelling does count. I guess handwriting does too. Let's go ahead and move on. Friendly competition, folks. Question number 4. All right, fill in the blank. Horner's syndrome consists of blank, ptosis, and decreased sweating. Timer begins now. All right, teams, 30 seconds is now up. Teams, please raise your whiteboards. Whiteboards up, Dr. Vitente? All right. And the correct answer is meiosis. Florida International University, let's see your whiteboard. FIU, that is correct. Florida Southern, that is incorrect. NSU, that is correct. University of Central Florida. UCF, that is incorrect. Please reveal your answer. That is incorrect. UNF, please reveal your answer. That is incorrect. University of St. Augustine, please reveal your answer. USA, that is incorrect. All right, everybody. Any challenges on the floor before I proceed? No challenges? Moving on to question 5 of the easy round. Yes, I said easy round. I'm very proud of you all. Let's go ahead and continue. What is the terminology that refers to the penetration of food, liquid, saliva, or gastric reflux into the airway? Occurs in about 1/3 of patients with dysphagia that can lead to acute respiratory distress within hours. 30 seconds on the timer. Hit it, Sophie. All right, team, that is it. 30 seconds is up. Please raise your whiteboard. Dr. Vitente, University of St. Augustine, please. Oh, everyone's got it up. Keep them up, everybody. Correct answer is aspiration. Not inspiration, aspiration. That was a terrible joke. Sorry, y'all. Okay, FIU, please reveal your answer. That is correct. Florida Southern, let's see it. FSC, that is correct. Nova Southeastern. Nova Southeastern, that is incorrect. Central Florida, reveal your answer. UCF, that is correct. University of Miami, let's see your answer. UM, that is correct. University of North Florida, that's correct. And last but certainly not least, USA, that is incorrect. Any challenges on the floor before I proceed? No challenges. Question number 6 of the easy round. We're chugging right along, everybody. What is the breathing exercise that is used by patients with chronic obstructive pulmonary disease, COPD, that may delay or prevent airway collapse, allowing for better gas exchange? 30 seconds on the clock. Go! All right. I'm sure y'all can hear Sophie's voice in the background. Like I said, couldn't do it without her. 30 seconds is up. Whiteboards up, please. All right, all whiteboards up. And the correct answer is pursed lips breathing. All right, FIU, let's see it. FIU, that is correct. Florida Southern, reveal your answer. Florida Southern, that is incorrect. Good attempt. Nova Southeastern, please reveal your answer. What did I say? Oh, I'm so sorry. Nova Southeastern, that is correct. Sorry, y'all, bear with me here. UCF, please reveal your answer. That is correct. University of Miami? UM, that is also correct. North Florida, let's see your answer. UNF, that is correct. And University of St. Augustine. That is correct. Any challenges on the floor before I proceed? No challenges? We shall continue. Question 7 of the easy round. Question 7. The line pointed by the green arrow is inserted into what specific chamber of the heart? I'm going to read that again. The line pointed by the green arrow on the right image is inserted into what specific chamber of the heart? 30 seconds on the clock. Go! teams, time is up. Please raise your whiteboards. Dr. Vitente, waiting on your thumbs up. University of Miami, please raise your whiteboard. UM, thank you so much. All other teams, whiteboards are up, and the correct answer is the right atrium. Must be specific for this answer, as always, actually. All right, FIU, let's see what you got. That is correct. Florida Southern. That is also correct. NSU. NSU. That is correct. UCF. Also correct. University of Miami. Also correct. UNF. Correct. Let's see if we can go 7 for 7. St. Augustine, give it to me. Yes, let's go. 7 for 7, baby. Let's keep on going, guys. Question 8 of the easy round. All right, question 8. Compute for the ABI. I will not be defining ABI as I expect all of you guys to know that. 30 seconds. Go. All right, teams, that's it. 30 seconds is up. Please raise your whiteboards. Florida International. All right, everyone's good to go. And the answer is 1. Just 1. I cracked myself up. All right, Florida International University, please reveal your answer. That is incorrect. Florida Southern, let's see it. That is correct. Nova Southeastern, please reveal yours. Incorrect. Central Florida? Incorrect. University of Miami? That is correct. North Florida? Incorrect. So sorry. St. Augustine, reveal yours. St. Augustine? That is correct. All right, any challenges on the floor before we continue? No challenges? Wow, we are cruising right along, everybody. Question 9 of the easy round. Please identify the deformity. 30 seconds, go! All right, team, that is it. Time's up. You already know this, but I gotta say it. Raise up those whiteboards. Dr. Vitente, waiting for your thumbs up. All right, all whiteboards are up. And the correct answer is swan neck deformity. Swan neck deformity. FIU, let's see it. FIU, that is correct. Florida Southern, please reveal your answer. Florida Southern, also correct. Nova Southeastern, please reveal yours. Nova Southeastern, that is correct. Central Florida, let's see what you got. UCF, that is correct. University of Miami. University of Miami, also correct. Another 7 for 7. North Florida, what you got? All right, that is correct. St. Augustine, that is correct. 7 for 7 twice before we even got to the moderate round. So proud. Really, I am proud. Question 10, last one of the easy round. Hope everybody's having a good time. I know I am. Low-key losing my voice a little bit. Okay, please identify the nerve that is being maximally elongated in this position pictured to the right? 30 seconds, go! All right, teams, you heard it here. Time's up. Whiteboards up. All whiteboards up? All right, and the correct answer is radial nerve. FIU, show us what you got. That is correct. Florida Southern. That is incorrect. Nova Southeastern. That is correct. Central Florida. Central Florida, that is correct. University of Miami. UM, also correct. UNF, reveal your answer. Correct. And lastly, USA, what you got? Also correct. Well done. All right, everybody, that completes the end of the easy round. Before we reveal the scoreboard, let's hear a word from our sponsors. We'll be right back. All right, everybody. We're going to go ahead and reveal the scoreboard. I will go with third place first. Third place is actually tied between St. Augustine and Central Florida with 5 points. Second place, coming in with the silver, we've got Florida Southern and Nova Southeastern with 6. And for first place, we actually have a three-way tie, FIU, UM, and UNF with 7 points. Neck and neck. Let's go ahead and continue. Question number 1 of the moderate round. Just a reminder, each correct answer, of this round is worth 2 points. Question 1, compute the percentage of body surface area burn in adults. Entire right lower extremity, perineum, and anterior right upper extremity. Give you a few seconds before we start the timer, and go! All right, everybody, timer's up. That means whiteboards go up. Whiteboards are up. Great. And the correct answer is 23.5%. FIU, please reveal your answer. FIU, that is incorrect. Florida Southern, also incorrect. Nova Southeastern, incorrect. Very close. Central Florida, please reveal your answer. That is correct. University of Miami, please reveal yours. That is incorrect. University of North Florida, that is incorrect. And USA, that is incorrect. All right, everybody, any challenges on the floor before we proceed? No challenges? Question 2 of the moderate round. Y'all are making my life and the Board of Judges' lives a lot easier. All right, identify the test. Pictured to the right. 45 seconds on the clock. Go! Teams, 45 seconds is up. Sorry, I was too busy getting fanned off. It's a little hot in this room. All right. Dr. Vitente, all whiteboards up. He gave me the thumbs up. FIU, let's see your answer. Oh my goodness. The answer first is the Finkelstein test. Now, FIU, please reveal your answer. FIU, that is correct. FSC, Florida Southern, let's see it. Florida Southern, that is correct. Nova Southeastern. Nova, also correct. Central Florida, reveal your answer. Central Florida, that is incorrect. University of Miami. UM, that is incorrect. University of North Florida. UNF, that is correct. University of St. Augustine, that is correct. Any challenges before we proceed? No challenges? We shall continue. Question 3 of the moderate round. Among the post-surgical dressings, which provides excellent edema control and residual limb protection? 45 seconds on the clock. Sophie, hit it! Atta girl. Before we proceed, we have a challenge from NSU. We did not scroll down appropriately, and we just heard from one of the proctors. So we're going to go ahead and hear from NSU. Go ahead and unmute yourselves and begin speaking.
Are we still considering spelling in this round?
For the last question.
For the last
for
question.
Finkelstein's test.
Yes. Again.
Yes. We are considering spelling.
Spelling the last round.
Yes.
Spelling counts for all rounds. Easy, moderate, difficult. Did we see something that we weren't supposed to see?
Last round there was misspelling the 16.
Okay.
We will review that.
We will review that. Give us a couple of moments. We'll take a commercial break.
So go ahead.
Dr. Johnson, I believe we need your assistance on this one.
Because one of the groups says Finkelstein test for tenosynovitis.
Do we have the? Is it possible to review the recording?
Is it possible to review the recording?
No, we need to stop this session before we can review the recording. I think that I know what she's talking about, the Finkelstein test for tenosynovitis, but that's just to make it complete.
It appears as though that's not
correct.
It appears that it's not correct because it
she was
states
shaking
there.
her head.
NSU. Can you identify who are these teams?
I don't remember who they were, but there was a couple teams that had it was FINKLE.
Yeah, so the L and the E were flipped.
Challenging thing to do, but unfortunately we can't rewind a live stream unless we stop the broadcast now, wait for it to load, then we can go back and join together. If any of the teams are willing to own up to spelling it incorrectly, that would make things a lot easier. If not, we may just have to move forward and just trust that we will all be on the same page moving forward.
Dr. Johnson, since you're the chair of the Board of Judges, are we going to proceed? Since your decision is final.
Yes. Hey, Mackenzie. So suggestion from the Board of Judges was just to eliminate that question altogether. And so no point should be awarded to any team.
Is that your final answer, Dr. Johnson?
Yes.
Instead of asking me, can you make it more of a confirmatory statement, please?
So the Board of Judges discussed it, and we feel the best or the most appropriate action would just be eliminate that question from this round. So nobody would be awarded points for that. Or obviously, so you just go that. It would be 9 questions in this section.
All right, great, Dr. Johnson. Thank you so much. Zophie, as our scorekeeper, we have decided to go without that question. So there will only be 9 questions in this moderate round. So please remove the points that you awarded to our respective teams that got that answer correct or incorrect. And from this point forward, we will make sure to really look at everybody's answers to make sure that spelling is accurate. Thank you, Nova Southeastern, for bringing that up. We'll do our best to make sure that doesn't happen again. I forget where we were. Let's go ahead and begin question.
That's the question.
Correct. Question 3.
Yeah, that's the question. Okay.
Yeah. Question 3. Among the post-surgical dressings, which provides excellent edema control and residual limb protection? 45 seconds. Now. teams, 45 seconds is up. Please raise your whiteboards. All whiteboards are up. And the correct answer is immediate post-operative prosthesis. FIU, please reveal your answer. FIU, that is incorrect. Florida Southern, please reveal yours. Florida Southern, that is also incorrect. Nova Southeastern. NSU, that is incorrect. University of Central Florida. UCF, that is incorrect. University of Miami, that is incorrect. University of North Florida. UNF, that is incorrect. University of St. Augustine. University of St. Augustine, that is correct. Well done. Any challenges on the floor before I begin? Before I proceed? No challenges? Yes? No challenges. We're going to move on to question 4 of the moderate round. Question 4 reads, what is this clinical syndrome characterized by disturbed consciousness, cognitive function, or perception where hospitalized older adults are most at risk for this extremely common and serious condition, and it develops in 2 to 50% of older people on general medicine wards and increases with increasing severity of illness. Again, you do get 45 seconds. Take your time, teams. Clock begins now. Alright team, 45 seconds is up. Dr. Vitente, waiting on your thumbs up. All whiteboards up? Nice. And the correct answer is delirium. FIU, please reveal your answer. FIU, that is correct. Florida Southern, let's see your answer. Florida Southern, that is incorrect. Nova Southeastern. Nova, that is correct. Central Florida, let's see what you got. UCF, that is incorrect. University of Miami. University of Miami, that is correct. University of North Florida. UNF, that is correct. St. Augustine. University of St. Augustine, that is incorrect. Any challenges on the floor before I proceed? No challenges. Great. Let's move on to question 5, halfway through moderate round. Just as a reminder, each correct answer is worth 2 points. Question 5. The drugs most commonly used to treat Alzheimer's disease attempt to increase the function of this neurotransmitter in the brain. Please identify this specific neurotransmitter. 45 seconds, go! Teams, 45 seconds is up. Please raise up those whiteboards. Dr. Vitente, University of Miami, raise up that whiteboard. They're all raised. Correct answer is acetylcholine. We're going to pay special attention to the spelling, so we're going to take our times running through each of these answers. Florida International, please reveal your answer. Florida International, that is correct. Florida Southern. Florida Southern, that is correct. Nova Southeastern. Nova Southeastern, that is incorrect. UCF. UCF, that is correct. University of Miami. That is incorrect. North Florida, what you got? North Florida, that is correct. And St. Augustine, reveal your answer. University of St. Augustine, that is correct. Thank you for your spelling, Matthew. We really appreciate it. All right, any challenges or rebuttals on the floor? No challenges. We shall continue. Question 6 of the moderate round. And it reads, digitalis glycosides is one of the cardiovascular drug groups. What is the primary indication of this drug? 45 seconds. Timer begins now. All right, teams, 45 seconds is already up. Please raise your whiteboards. All whiteboards up. And the correct answer is congestive heart failure. FIU, please reveal your answer. FIU, that is correct. Florida Southern, let's see your answer. Florida Southern, that is incorrect. Nova Southeastern, let's see your answer. Nova Southeastern, that is incorrect. Central Florida, what you got? Central Florida, that is incorrect. University of Miami? University of Miami, that is correct. University of North Florida, reveal your answer. UNF, that is incorrect. St. Augustine, reveal your answer. Board of Judges, Dr. Johnson.
Let me just chat with the other two gentlemen real quick to clarify. All right, so the Board of Judges has said that it is an incomplete answer because it could be acute heart failure. Obviously, in this case, we're looking for congestive heart failure.
Can you guys hear me? In the literature, however, it's described as just heart failure sometimes. So I would say it's not.
Yeah, I mean, That is possible, but particularly in this case, we're looking for congestive heart failure.
Okay. In other answers, you didn't take off points though for someone who added additional word. So why should we get points off?
You're missing a keyword.
Okay.
That's really our issue. Again, it could describe other types of heart failure, and specifically, we're looking for that congestive part.
Okay. Thanks.
So thank you.
Johnson, thank you. And University of St. Augustine, thank you for being a great sport. We really appreciate all of this. Moving on. University of St. Augustine, that is incorrect. Thank you, Zophie, for asking. Zophie's great at scorekeeping. She's keeping me in check. I love it. All right. Any other challenges on the floor before we proceed? No challenges. Moving on to question 7 of the moderate round. Question 7. Please identify the tendon that is potentially ruptured if the test depicted in this image is positive. 45 seconds on the clock. Hit it, Zoph! All right, teams, time is up. Once again, we are identifying the tendon, not the test. All right. Dr. Vitente, all whiteboards up. All whiteboards up. It is confirmed. And the correct answer is flexor digitorum profundus. All right. FIU, please reveal your answer. FIU, that is correct. Florida Southern. Florida Southern, that is also correct. Nova Southeastern. Nova Southeastern, also correct. Central Florida, what you got? All right, that is also correct. University of Miami. University of Miami, also correct. North Florida, reveal your answer. Board of Judges, Dr. Johnson, looks like we need your help.
What are we trying to clarify? Just it looks. I see an I in there. Is that what we're looking at?
Dr. Johnson, can you hear me?
Yes, I can hear you.
I believe we're trying to clarify their additional wording, as that has also been a concern from one of our schools. Is on the fourth digit. Okay.
I think it's a correct answer. It's adding a little bit specificity to it, but other than that, I think it's everything else is correct. It should be counted as a correct answer.
All right, you heard it here first, Dr. Johnson. Like we said, decisions made by Board of Judges are final. So, what school was that? UNF, North Florida. That is correct. Just want to confirm. All right, St. Augustine, what you got? University of St. Augustine, that is correct. Any challenges on the floor before we proceed? No challenges? Moving on to question 8 of the moderate round. Question 8. In the image, the examiner should look for an orange halo forming on the gauze pad in a patient with a head injury, seen in the photograph on the right. What is the indication of the presence of the halo? 45 seconds, go! 45 seconds is up. You know what that means? Whiteboards also go up. Dr. Vitente? I got a thumbs up. Oh. University of St. Augustine? I need to see that whiteboard. Great. Keep them up, guys. All right, the correct answer is presence of cerebrospinal fluid or skull fracture. We will accept either or. FIU, please reveal your answer. FIU, that is correct. Florida Southern, please reveal your answer. Florida Southern, also correct. Nova Southeastern. Nova Southeastern, that is correct. University of Central Florida, please reveal yours. UCF, also correct. University of Miami, what you got? University of Miami, also correct. University of North Florida, correct. Can we go 7 for 7? St. Augustine, bring us home. Oh no! Good attempt, St. Augustine, but unfortunately, that is incorrect. All right, any challenges on the floor before we proceed? University of North Florida, we'll pin you now. Go ahead and unmute, and you have the floor.
Is the spelling of cerebral spinal fluid correct? Because one of the teams answered that instead of cerebrospinal.
Dr. Johnson?
Yes, I would accept. I would accept those. I mean, either cerebrospinal fluid or cerebral spinal fluid.
All right. Once again, you heard it here first. University of North Florida, thank you for posing the question. I thought it was a very fair one, and you heard Dr. Johnson. He will accept either or. Any other challenges before we continue? No more. Question 9 of the moderate round. And it reads, what is a popular tool used to measure a patient's self-perceived handicap as a result of vestibular disorders? It's composed of 25 questions that are subgrouped into 3 components: functional, emotional, and physical. What is that tool? 45 seconds, go! Teams, and just like that, 45 seconds is up. You already know what I'm gonna say, but I gotta say it. Whiteboards up, please. Dr. Vitente, all whiteboards up. And the correct answer is dizziness, handicap, inventory. We will not be accepting DHI, although that is the appropriate abbreviation. All right, FIU, let's see that answer. FIU, that is incorrect. Florida Southern, please reveal yours. Florida Southern, that is incorrect. Nova Southeastern, what you got? Nova Southeastern, that is incorrect. University of Central Florida, please reveal your answer. UCF, that is incorrect. University of Miami, what you got? Board of Judges, looks like we need your help on this one.
Let me talk it over real quick with the other gentleman.
We're going to go ahead and pause for a short break while Dr. Johnson communicates with the remainder of the judges. Oh, yes, big reminder. Thank you, Dr. Vitente. Keep your whiteboards up. Keep them up. Don't put them down. I'm watching you. sure if anybody could see me taking a little snack there. Dr. Johnson?
All right, so I've talked it over with the other two judges, and even though it is close, unfortunately, we will not accept it because in the literature, it is actually described as a dizziness handicap inventory for research purposes and then just in general use. So it will be incorrect.
All right, Dr. Johnson, thank you so much. University of Miami, awesome attempt. University of North Florida, let's see what you got. That is incorrect. St. Augustine, please reveal your answer. And that is also incorrect. Teams, any challenges on the floor before we continue? No challenges. Last question of the moderate round of the Battle of the Brains Season 2. Are we ready? You better be, because I'm about to read it. In Ranchos Los Amigos, levels of cognitive functioning, what is level 4? 45 seconds. Sophie, hit it. My girl. I'm having too much fun. All right, 45 seconds is up. Once again, this is the last question of the moderate round. Each question, only 2 points. Teams, raise your whiteboards. All whiteboards are raised, and the correct answer is confused, agitated. All right, FIU, reveal your answer. FIU, unfortunately, that is incorrect. Florida Southern. Florida Southern, that is correct. Nova Southeastern University. That is incorrect. University of Central Florida. UCF, that is incorrect. University of Miami, please reveal your answer. Board of Judges. Dr. Johnson?
Give me just one moment.
Just a quick reminder, everybody, while Dr. Johnson is communicating with the other 2 board judges, please keep your whiteboards up and we'll be back in about 30 seconds.
The University of Miami is well known for its commitment to excellence while educating its Doctor of Physical Therapy students. That same commitment can now be found in our 6 physical therapy residency programs. Our team is now proud to offer post-professional residency programs in a variety of practice specialties. Such areas of practice include cardiovascular and pulmonary rehab, geriatrics, neurology, orthopedics, pediatrics, and sports physical therapy. Whatever your desired specialization may be, you'll find it here at the U. We are currently seeking candidates to apply for the position within the 2021 to 2022 cohort. We seek current licensed physical therapists or soon-to-be DPT graduates who are passionate about excelling into a particular field of practice within the profession. All our residency programs strive to promote distinction and mastery within practice, leadership within our profession, and innovation for the future. We hope that you'll strongly consider University of Miami for your post-professional residency training. For more information, see our website at pt.med.miami.edu. Thank you.
For that commercial from the University of Miami. Dr. Johnson, the floor is yours.
Okay, so we've discussed it, and we will accept that as a correct answer since it uses the word "and," so it's describing both of those conditions.
University of Miami, that is correct. All right, University of North Florida, please reveal your answer. University of North Florida, incorrect. And lastly, but certainly not least, as always, University of St. Augustine. USA, that is correct. All right, teams, that ends the moderate round of FPTA Battle of the Brains Season 2. I know all of you guys are really looking forward to seeing that scoreboard, as are we. So we're going to go ahead and take a moment to listen to a word from our sponsors, and we'll be right back. See you soon. Wait, Sophie. Sorry about that. Technical difficulty as I'm in the middle of eating a chip. Give us a moment.
Miami is a great city.
I love Miami. I've been here my whole life.
There's just such a diversity of people. People from all different cultures, all different backgrounds.
This is the place to be.
There's just so much to do around here. It's like in the central of Miami.
This is like the heart kind of Miami.
The spices of Little Havana, the historic district.
The trolley, which is unique to Coral Gables, as well as like the metro to get around the city. Not too far from here, there's Miracle Mile.
Also has a lot of really nice, boutique restaurants.
Restaurants everywhere.
We have a very famous one called Versailles. Grab their cafecito with croquetas and pastries, which are very unique to Miami.
You have the beach, you have great nightlife here.
The water is really pretty down here. The beach is only 20 minutes away.
It's very fun here.
All right, teams. The moment you've all been waiting for. I already know it. It's like you're just shaking in your pants. I know I was. All right, in third place, we've got Florida Southern with 14 points. Second place, University of North Florida with 15. And in first, we have a two-way tie between Florida International University and the University of Miami with 17 points. All right, everybody, we're going to go ahead and continue on to the difficult round. Question 1 reads, what is the ligament that is also known as the Y ligament or ligament of Bigelow? 45 seconds, starting now. All right, teams, 45 seconds is up. Just as a reminder, we are beginning the difficult round, so each correct answer is worth 3 whole points. All right, all whiteboards up, Dr. Vitente? He gave me the thumbs up. The correct answer is iliofemoral ligament. FIU, please reveal your answer. FIU, that is correct. Florida Southern, please reveal yours. Florida Southern? What? Board of Judges?
I would say at this point, I mean, the question does state what is the ligament that is also known for the Y ligament. I think I would accept iliofemoral as a correct answer since the question already states what ligament it is.
Wonderful, Dr. Johnson. Thank you for confirming that. Florida Southern, that is correct. Nova Southeastern, please reveal yours. Nova Southeastern, that is incorrect. University of Central Florida. UCF, that is correct. University of Miami. UM, that is correct. University of North Florida, what you got? UNF, that is correct. University of St. Augustine, please reveal your answer. University of St. Augustine, that is correct. All right, any challenges on the floor before proceeding? No challenges? We shall move on. Question 2 of the difficult round. Please identify the 3 pes anserine muscle group. Once again, identify the 3 muscles that make up the pes anserine muscle group. 45 seconds. Sophie, you already know. Hit it! Teams, just like that, 45 seconds is up. You know what that means. Whiteboards up, please. Dr. Vitente. Yep, all whiteboards up. And the correct answer is sartorius, gracilis, and semitendinosus. All right, FIU, please reveal your answer. FIU, that is correct. Florida Southern, please reveal yours. Board of Judges, Dr. Johnson, we need your assistance on this.
All right, give me just 1 second. All right, can you hear me? Okay, so we will unfortunately have to say that is incorrect due to an incorrect spelling of semitendinosus.
Florida Southern, you heard it here first. That is incorrect for Florida Southern, Sophie. All right, Nova Southeastern, what you got? Nova Southeastern, that is correct. University of Central Florida, please reveal your answer. University of Central Florida, that is correct. University of Miami, please reveal yours. University of Miami, that is correct. North Florida, what you got? University of North Florida, that is incorrect. University of St. Augustine. University of St. Augustine, that is correct. All right. Do we have any challenges on the floor before I proceed?
UCF.
University of Central Florida. Go ahead and unmute yourself. You have the floor.
We just wanted to double check this tendinosis. I think we saw an SIS at the end.
University of Central Florida, I'm so sorry. Let me give us like 2 seconds, allow us to mute ourselves, and then if you could say that again, it was a little bit choppy. So, Dr. Vitente, if you can mute me, and then UCF.
Yeah, we just wanted to double check the spelling of NSU's semitendinosis. I think we saw SIS at the end, and it should be SUS.
All right, University of Central Florida, thank you for bringing that up. Nova Southeastern, thank you for your honesty and for also not erasing your answer. That made things a lot easier. Thank you for the double thumbs up. You guys are quite the troopers here and not game players. What's the word I'm looking for? Come on, help me out here. Team players, not game players. What am I thinking? It's getting late. Okay, awesome job, everybody. Moving on. Oh. So, what school are we at?
No, we're done.
That was it. NSU was incorrect. Yes. We're getting some questions from our scorekeeper. We want to make sure that we're doing this fair. So, NSU was incorrect, yes. Okay, moving on. Question 3 of the difficult round. What bone is often referred to as the keystone of the medial longitudinal arch? 45 seconds, starting now. Just like that, 45 seconds is up. You know what that means. Dr. Vitente, all whiteboards up. University of North Florida, whiteboard up, please. Yes, all whiteboards up. All right, and the correct answer is talus, tomato, tomato. All right. FIU, please reveal your answer. FIU, that is incorrect. Florida Southern, that is incorrect. Nova Southeastern, that is incorrect. University of Central Florida, that is incorrect. University of Miami, that is incorrect. University of North Florida, that is incorrect. University of St. Augustine, that is also incorrect. Okay, 0 for 7, at least we're all kind of on the same page here. All right, any challenges to that last question before moving forward? No challenges? Question 4 of the difficult round. And it reads, what is the normal value for HCO2, which is an amount of alkaline substance dissolved in arterial blood? Again, what is the normal value for HCO2? 45 seconds, go! All right, teams, time is up. Whiteboards up. Dr. Vitente? All right. The correct answer is 22 to 26 milliliters equivalent liters. Is that appropriate? Milliequivalent liters. Sweet.
Per liter.
Per liter. That's what I meant. All right. FIU, please reveal your answer. 20. That is incorrect. Florida Southern, please reveal yours. That is incorrect. Nova Southeastern. Nova Southeastern, that is correct. University of Central Florida. UCF, that is incorrect. University of Miami, please reveal your answer. University of Miami, that is correct. University of North Florida, let's see it. That is incorrect. All right, University of St. Augustine. University of St. Augustine, that is incorrect. Any challenges on the floor before I proceed? No challenges? All right, let's go ahead. We're halfway there through the end of this battle. Question 5 of the difficult round. Progressive bulbar palsy is a motor neuron disorder subtype that involves degeneration of which 4 cranial nerves? Notice how it says all or none. You need to have all 4 listed in order to get all 3 points for this question. 45 seconds on the clock. Sophie, hit it! All right, teams, time is up. Get your last minute answers on there. Dr. Vitente, you let me know when all whiteboards are up. University of North Florida, please raise your whiteboard. All whiteboards are now up, and the correct answer is cranial nerves 9 to 12. That is glossopharyngeal, vagus, accessory, and hypoglossal. If you just have written 9 to 12, that is acceptable. All right, FIU, show us what you got. FIU, that is incorrect. Florida Southern. Florida Southern, that is also incorrect. Nova Southeastern. Nova Southeastern, incorrect. University of Central Florida. University of Central Florida, incorrect. University of Miami. University of Miami, that is incorrect. University of North Florida. University of North Florida, that is correct. All right, University of St. Augustine.
Board of Judges.
Board of Judges.
Give me 1 second. Okay, so I've talked it over with the other judges, and we will accept that as an answer. because they had 9, 10, 11, and 12 included.
Thank you. Thank you, sir. Appreciate you guys.
The University of St. Augustine, you heard it from Dr. Johnson. That is correct. All right. Any challenges on the floor before we proceed? No challenges. All right, guys, we're over halfway through the end of this difficult round. Question number 6. And it reads, what is the term used to describe poor or pathological emotional control, including spontaneous crying or laughter occurring in the absence of emotional triggers? It's a tricky one. Make sure to read it carefully, y'all. All right, timer begins now. All right, teams. Time is up. Whiteboard's up. All whiteboards up, Dr. Vitente? All whiteboards are up, and the correct answer is pseudobulbar affect. FIU. Let's see what you got. FIU, that is incorrect. Florida Southern. Also incorrect. Nova Southeastern. That is also incorrect. University of Central Florida. Incorrect. University of Miami. Incorrect. University of North Florida. UNF, that is incorrect. St. Augustine. University of St. Augustine. That is incorrect. As you did spell it with an E instead of an A. Board of Judges, can you please confirm?
Yes, give me just 1 second.
Dr. Johnson, the floor is yours whenever you are ready.
Okay, so I've got actually a couple things to address here. So for the first question, as far as the pseudobulbar effect, unfortunately that is incorrect because effect and affect are not the same thing. So we will have to count that as an incorrect answer. But as talking to the two other judges, there were a couple of answers actually previous that would be terms that could be used in place of pseudobulbar affect. I think the first group had answered emotional lability. And then one of the groups had labile affect. Yes, so those... as according to, yes, correct. Perfect. Those will be counted as correct answers.
Second. Dr. Johnson, thank you so much. University of St. Augustine, I really appreciate your attempt. I appreciate your patience with us. Unfortunately, USA, that is incorrect. And FIU, Sophie, as well as Nova Southeastern University got that answer correct according to the Board of Judges. So I'm going to repeat that just in case. USA, incorrect. FIU and Nova Southeastern, correct.
Got it.
All right. Awesome. Ladies and gentlemen, if you'll bear with us for just one moment, we have one team that needs to relocate from where they are. So we'll be playing a few commercials. Just hang tight and we'll be right back. Only 4 more questions and we are through. Hang in there, guys.
The University of Miami is well known for its commitment to excellence while educating its Doctor of Physical Therapy students. That same commitment can now be found in our 6 physical therapy residency programs. Our team is now proud to offer post-professional residency programs in a variety of practice specialties. Such areas of practice include cardiovascular and pulmonary rehab, geriatrics, neurology, orthopedics, pediatrics, and sports physical therapy. Whatever your desired specialization may be, you'll find it here at the U. We are currently seeking candidates to apply for the position within the 2021 to 2022 cohort. We seek current licensed physical therapists or soon-to-be DPT graduates who are passionate about excelling into a particular field of practice within the profession. All our residency programs strive to promote distinction and mastery within practice, leadership within our profession, and innovation for the future. We hope that you'll strongly consider University of Miami for your post-professional residency training. For more information, see our website at pt.med.miami.edu. Thank you.
I'm Dr. Thomas Arvie. I'm a physical therapist, and I'm owner of FIAP, which is the Florida Institute of Orthopedic Manual Physical Therapy. We offer orthopedic certification programs for physical therapists, physical therapist assistants, and occupational therapists. Karen not only did her PTA certification this year, but also completed her safety certification. So she's getting 2 of these tonight. So great job. We've been running these programs for over 5 years. We have over 100 graduates, and tonight we're at the Funky Voodoo restaurant in Oakland Park, Florida, at a graduation event with over 25 graduates this year.
I want to say thank you very much, Thomas, and your fantastic company for teaching me and getting me certified over here.
Every single one of our graduates right now said, you know what, I want to be better, and I want to be better for my patients. And that is a huge sign of integrity and professionalism. And I think that we should all give them a round of applause just for that. We will be offering programs in 2018. Check out our website at fiamp.com, FIOMPT.com, for more information.
All right, teams. Thank you for your patience. Hopefully the school that needed the time got the time that they needed. Can you give me a thumbs up? Sweet, I can see you guys. Awesome. All right, question 7 of the difficult round. Whew, just gotta breathe in real quick. This is almost done, guys. What is the syndrome that occurs from hemisection of the spinal cord and is typically caused by penetration wounds like a gunshot or a stab? 45 seconds, go! All right, teams, time is up. If you'll go ahead and raise your whiteboards. All whiteboards are up, Dr. Vitente. All right, and the correct answer is Brown-Séquard syndrome. All right, FIU, show us what you got. FIU, that is correct. Florida Southern. Florida Southern, Board of Judges. This is on you and not on me. Please, we need your guidance on it.
All right, so unfortunately it's misspelled, so we will have to reject it. It is an incorrect answer.
Okay. FSC, that is incorrect. Nova Southeastern. Nova Southeastern, that is correct. University of Central Florida. That is incorrect. University of Miami, please reveal your answer. University of Miami, that is correct. University of North Florida. Let's see your answer. University of North Florida, that is correct. University of St. Augustine. Let's see it. USA, that is correct. All right. Any challenges on the floor before I continue? No challenges. All right. Before we continue, I want to make one announcement. We did just receive a message from the chair of the Board of Judges asking if it would be possible to add an 11th question to this difficult round. Since that first round, we weren't able to get all 10, to make a total of 30 questions to kind of make it fair for everybody. Like I said, whatever the Board of Judges say goes. So we're going to go ahead and add an 11th question. So difficult round is 11 questions. We're moving on to the 8th. Question number 8 of the difficult round. What reflex is responsible for maintaining the stability of an image on the fovea of the retina during rapid head movements? Sophie, you got that timer ready? 45 seconds, go! All right, teams, time is up. You already know what it means, Dr. Vitente. Thumbs up. All right, and the correct answer is vestibulo-ocular reflex. If you put VOR, it will not be accepted. Once again, the correct answer is vestibulo-ocular reflex. FIU, show us what you got. FIU, that is correct. Florida Southern College, reveal yours. That is incorrect. Nova Southeastern. Nova Southeastern, that is incorrect. University of Central Florida. University of Central Florida, that is incorrect. University of Miami. University of Miami, that is correct. University of North Florida, please reveal your answer. Board of Judges, Dr. Johnson.
Yeah, so ocular is misspelled, so unfortunately it is an incorrect answer.
All right, University of North Florida, incorrect. Got that, Zoph? All right. Last but not least, University of St. Augustine. University of St. Augustine, that is correct. Any challenges on the floor before we move to question 9?
NSU.
Nova Southeastern, we shall pin you. Please unmute yourself and the floor is yours.
Oh no.
Just kidding. Any other challenges on the floor?
No.
All right, moving on to question 9, third to last. And it reads, what term is used to refer to systematically developed statements that make recommendations for practice based on the base... Okay, I did not read that. Guys, it's been such a long day. Please bear with me. I'm going to start over. What term is used to refer to systematically developed statements that make recommendations for practice based on the best available evidence? Question mark. 45 seconds. Go! All right, teams, time is up. You already know what it is. Bring that whiteboard up and keep them up there. All right, the correct answer is clinical practice guidelines. Not CPGs, but clinical practice guidelines. All right, FIU, show us what you got. FIU, that is correct. Florida Southern, reveal your answer. Florida Southern, that is also correct. Nova Southeastern, that is correct. University of Central Florida. University of Central Florida, that is correct. University of Miami, that is correct. North Florida, reveal your answer. That is correct. 7 for 7, St. Augustine, show me what you got. All right, 7 for 7, you guys, awesome. I'm sorry, ladies and gentlemen is more correct. All right, second to last question for the difficult round of Battle of the Brains Season 2. And it reads, there are 8 core values in physical therapy, according to the APTA. What is the most recently added core value during the 2021 American Physical Therapy Association House of Delegates? 45 seconds, starting now. Raise those whiteboards. Dr. Vitente, are all whiteboards raised? All whiteboards are raised. Florida International University. Oh, just kidding. Not all whiteboards are raised. Hold on. All right. All whiteboards are now raised. Correct answer is inclusion. Inclusion. FIU, what you got? Florida International University, that is correct. All right. Florida Southern, reveal your answer. Florida Southern, that is incorrect. Nova Southeastern, please reveal your answer. Nova, that is incorrect. University of Central Florida, please reveal your answer. University of Central Florida, that is incorrect. University of Miami, what you got? Board of Judges. Dr. Johnson, we need you.
Give me 1 second to talk it over with the other two gentlemen. Right. All right. So after talking with the board, we have decided to accept that as a correct answer because it does have inclusion as part of the word.
Great. Dr. Johnson, thank you so much. University of Miami, that is correct. Got it, Zoph? All right. University of North Florida, please reveal your answer. UNF, that is incorrect. University of St. Augustine. University of St. Augustine, that is correct. All right, everybody. I can't believe it. It's kind of making me a little sad, but we are moving on to the last question of tonight's Battle of the Brains Season 2. Are there any challenges from the previous question before I proceed? No challenges? We shall continue. All right. Last question. And it reads, as the arch rises, it mechanically forces the foot into supination. The result of the foot being in supination creates the rigid lever necessary for push-off. What do you call this effect? 45 seconds, starting now. All right, teams, just like that, 45 seconds is up. All whiteboards need to be up. University of North Florida, please raise your whiteboard. All whiteboards are now up, and the correct answer is the windlass effect. FIU, please reveal your answer. Board of Judges, Dr. Johnson, we need your assistance.
We were actually just talking about this. So we will accept that as a correct answer, win-loss mechanism.
All right, Dr. Johnson, thank you so much. FIU, correct. Florida Southern College, please reveal your answer. Florida Southern, that is correct. Nova Southeastern, Nova, that is incorrect. University of Central Florida. UCF, that is correct. University of Miami, please reveal your answer. University of Miami, that is correct. University of North Florida, please reveal yours. UNF, that is correct. Last and certainly not least, University of St. Augustine, that is correct. All right, everybody, this actually concludes the end of the Battle of the Brains, but we still have to show you guys the scoreboard. So we're going to pause for a brief commercial break as we get that together, and we will be back shortly.
Did you know NSU offers 2 fully accredited clinical residency programs in neurologic and orthopedic physical therapy? We partner with 2 major health systems and 2 state-of-the-art clinics for residency placements in Southeast Florida and Tampa. Our residents receive mentoring from board-certified clinical and academic faculty and gain valuable experience teaching in our DPT programs. To find out more, visit our website or schedule a virtual or on-campus tour. See what NSU can do for you.
Miami is a great city.
I love Miami. I've been here my whole life.
There's just such a diversity of people. People from all different cultures, all different backgrounds.
This is the place to be.
There's just so much to do around here. It's like in the central of Miami.
This is like the heart kind of Miami.
The spices of Little Havana, the historic district.
The trolley, which is unique to Coral Gables, as well as like the metro to get around the city. Not too far from here, there's Miracle Mile.
Also has a lot of really nice, boutique restaurants.
Restaurants everywhere.
We have a very famous one called Versailles. Grab their cafecito with croquetas and pastries, which are very unique to Miami.
You have the beach, you have great nightlife here.
The water is really pretty down here. The beach is only 20 minutes away.
It's very fun here.
All right, everybody, the moment we've all been waiting for before we show you the scoreboard, because it's going to end pretty quickly. I just want to thank everybody for being here tonight, for showing up, for being such phenomenal sports, and honestly, just having a great time. We look forward to seeing everybody next year, but first, let's see our scoreboard. All right, in third place with bronze, we have the University of St. Augustine with 37 points. And in first place, we actually have a tie between Florida International University and the University of Miami with 41 total points. Now, in the event of a tie, which we do have right now, each team will be given 30 seconds to answer one question. The team who gets the answer correct wins that clincher round. Now, if both teams answer the question correctly, we will continue to ask questions until a winner emerges. Once again, if there are any challenges or rebuttals, you make that little X marks the spot. Board of Judges will come on and their decision is final. All right? So USA, congratulations. Everybody else, you're welcome to stay. Thank you again for participating. Incredible job. UM and FIU, you're on the hot seat. Clincher question number 1. Clincher question number 1. Please identify the nerve that is maximally elongated in this photograph. 30 seconds is on the clock. Starting now! And just like that, 30 seconds is up. FIU and UM, please raise those whiteboards. Dr. Vitente, both teams have them raised. All right. And the correct answer is ulnar nerve. FIU, please display your answer. FIU, that is correct. University of Miami, let's see yours. University of Miami, also correct. All right, we are still in a tie, so we will continue to ask questions until a winner emerges. Clincher question number 3. Please identify the deformity in the photograph to the right. Sophie, only 30 seconds for this one. Timer starts now! All right, FIU and UM, time is up. Please raise those boards. Both boards raised? All right. And the correct answer is, I'm not going to say this right, Talip's equinovirus. Talip's equinovirus or clubfoot. We will accept either or. FIU, please reveal your answer. Board of Judges, we need your assistance. Dr. Johnson?
All right, give me a second to talk it over with the other 2 judges. Okay, we will accept that as a correct answer.
All right, FIU, you heard it from Dr. Johnson. FIU, Sophie, that is correct. University of Miami. Board of Judges.
All right, give me one moment. Okay, after discussing it with the other 2 judges, that answer is incorrect.
All right, everybody. You heard it here. Our champions for Battle of the Brains, Season 2, Florida International University. Yeah! All right, so first place, FIU. Second place, so close, the University of Miami. And third place, the University of St. Augustine, Miami campus. Wow, everybody, today has been the most fierce competition. Awesome work. FIU, would you like to say a word?
Oh, hello.
Shout out to FIU Miami. Let's go.
Pause up.
Paws up indeed. Awesome job, everybody. Thank you so much for all coming out here, for spending your time with us. So much love. Again, my name is Mackenzie Gussman. I am this year's quiz master. We got Dr. Arvie Vitente to my right and Sophia Hack to my left. We had so much fun. Thank you so much. We're going to leave you with a few words from Vice President of Florida Physical Therapy Association, Miss Lizelle Pilgrim. Thank you again, everybody. Oh.
Good afternoon, everyone. My name is Lizelle Pilgrim. I am the current Vice President of the Florida Physical Therapy Association, and I am also an assistant professor at the University of St. Augustine for Health Sciences, the Miami campus. I just want to take this opportunity to say congratulations to our winners. You have earned your bragging rights for the next year, so take it in and enjoy that moment. We are so proud of your dedication towards the profession and obviously your dedication towards your studies. To all the participants, keep at it. We can't wait to have you in our profession and to see what you do to move our profession forward. I'd like to take this opportunity to thank Dr. Vitente, the current chair of the Southeast District, for helping with this event, and of course, Mackenzie and Sophia for your awesome work. We are so proud of you and we can't wait till you're graduates and are seeing what you do in the profession as well. I'd also like to take this opportunity to thank our sponsors, University of Miami, Nova Southeastern University, the Mutual of Omaha, the Florida Institute of Orthopedic and Manual Physical Therapy, ServCare Home Health, ComQuest Home Care, and Art by Dr. Rhodey Joseph, the University of St. Augustine for Health Sciences, the Miami campus. Again, thank you to everyone for this great event, and I'll see you guys soon.
Thank you, Dr. Pilgrim. And last, but certainly not least, this event literally could not have been possible without our board of judges. Dr. Johnson, Dr. Tayag, and Dr. Dumaligan, thank you from the bottom of our hearts. Seriously, we actually could not have done this without your guidance. Thank you so much. We hope to see everybody again next year. Awesome job, everybody.
Congratulations, FIU!
Woohoo! Yeah!
Going.
Go USA!
Go UCF!
Go UM, but still, go FIU! Y'all killed it. Awesome job. So proud. So proud.
Awesome.
And FSC, thank you for your little board note. That was very sweet.
Loved it.
Bye, everybody.